And if the fat tissue under the skin is rather thick too, the nose becomes even more sleek and streamlined. If there is a lot of fat tissue in the wings of nose, the wings become greater. And however, they do not do so automatically. If someone puts on weight, it's possible that his face remains thin. This means that the fat is distributed unequally on the face. So now let's enumerate the nasal muscles. The transverse part of nasalis arises from the maxilla in the region overlying the root of the canine tooth. Its fibers pass over the dorsum of the nose to join the muscle from the opposite side. For example,
I show how
Jessica
it works.
Zor, Miley Cyrus, Kate Middleton, and many
When it's
more
stretched, these
have a
folds
very
are
small
formed.
curve. And this is the ala part of nasalis. This muscle originates from the maxilla in the region of the lateral incisor and inserts into the greater nasal cartilage. It draws the ala of nose downward and laterally to dilate the nostrils. And this is the depressor septi muscle, or depressor septi, I don't know how to pronounce. It rises from the incisor region of the maxilla, rises under the orbicular mouth muscle, and is attached to the skin of that covered the nasal septum. So nasal septum is here. This is the nasal septum. And how it works? It lowers that skin of nasal septum and closes the nostrils in this way. So, and this muscle, called levator labii superioris liquid nasi muscle. The liquid nasi muscle begins at the upper jaw, at the upper part of the frontal process of maxilla. Then it passes forwards and laterally at an oblique angle where it divides into medial and lateral slips. The medial slips joins the big lateral nose cartilage and the skin above the cartilage. When this split works, the nostrils widen, and the lateral slip is woven into the orbicular mouth muscle. When it works, the upper lip is lifted. So, like this. Now I give more examples of muscle-bounded noses. It doesn't mean that they have been purposely worked out. These muscles are naturally well developed and big just because the masters have been born with them. To illustrate how the growing muscles change the nose shape, I give this example. So, the shape of nasal bones and cartilages of Evgeny Mironov and Tatiana Kolganova is very similar. We see that the development of nasal muscles also develops the nose wings, despite that they consist mostly of fat. So anyways, certainly there is a question of the shape of bones and cartilages of these people is absolutely identical, but yes, but I think I have to show it. The nose tip, like there, becomes smoother. It doesn't repeat the shape of the cartilages. Because the muscles lying on it are greater. Now they form a smoother rounded tip themselves. If we add to this a great amount of fat tissue in the nose wings, although in Mironov's case it's not great, and if there is much fat under the nose skin as well, the nose becomes even more smooth, rounded, and streamlined. And it's also necessary to tell about the bony prominence on the upper jaw, which is called the acanthion. Well, its size also impacts on the nose shape. These are the photos before and after correction of a nose. The man had his nose straightened, nose tip lifted, and strongly protruding part of the acanthion there removed. So this has changed his profile greatly. Earlier in the ancient Greece, there was a concept of ideal beauty, presuming that in profile a person's forehead should pass straight to the nose. Look at these sculptures and at someone's mock picture, which is an attempt to illustrate how a model with the features of an ancient statue might look nowadays. So this woman looked similar, but she didn't like it. And additionally, to removing the bulge, she has had a part of her nasal bone cut up to this spot, which is called nasion. So this is the frontal bone. These are nasal bones. This is the anterior nasal spine of maxilla, and this is the nasion. So the more prominent it is, nasion, the more the face resembles to the ancient Greek beauty ideal. But this feature is more or less spread even nowadays. Have a look at Drew Barrymore. Her forehead median gradually passes to the nasal arch, and it looks almost like a straight line. Another example is Uma Thurman. Of course, her angle between the nose and the forehead is not a straight line, but it's very close to the Greek ideal. Or take, Yuri Kaplan, this guy. His forehead median relatively gradually passes into the nasal arch as well. And to compare, if we speak about Alexander Rybak, his nose is not altogether Greek. His nasion and nose bridge are not that big, and it's absolutely different. It's another type of beauty, actually. Also, Britney Spears had a strong nasion and a somewhat Greek profile. The same with Alla Chernyshova and Yana Churikova. Lera Kudryavtseva's nasion is somewhat deeper, and although her nose has a prominent bulge, it cannot be called Greek because her forehead doesn't pass into her nose as a straight line, so it's not Greek. Jessica Simpson's profile, despite her bulge, cannot be called Greek either. Mila Jovovich has a weak nasion, as well as a Ashwai Rai. Monica Bellucci's nasion is big and prominent, and her nose is very interesting one because it doesn't become wider downwards because her lower lateral cartilages are narrow and nose wings are small. And I'd like to add that the shape of this spot, the nasion, is also formed by muscles too. These are the frontal bellies of the epicranius muscle, and these are corrugator supercilii muscles that wrinkles brows. If they are big, the bulge will be bigger. And below there is a procerus muscle, I don't know how to pronounce, that starts from the nasal bone and the lateral nasal cartilage, goes upwards and is attached to the skin above the root of the nose. So if the procerus muscle is weak, the shape of bone followed at this place. And if it's well developed and big, this place will look differently and follow the shape of procerus muscle. And also, don't forget about the fat tissue. The thicker it is there, the more round and streamlined is this place. So now we understand how the nose is built. Next come the eyes.